am Janice Russell, and today's topic for Do You Know is Do you know about rheumatoid arthritis? Now, let me first say I am not a doctor, nor do I play one on TV. This information is for informational purposes only. It's not intended to be a substitute for professional medical advice, diagnosis, treatment, or anything like that. It's just to give you a little bit of information. I was curious about rheumatoid arthritis because I have some friends that have it. And so I wanted to learn more because I also know that over time I may have some clients that have it and I like to be informed. I will tell you that the sources of information I used are the Merck Manual, the Arthritis Foundation, and the American College of Rheumatology. So rheumatoid arthritis is the most common autoimmune type of arthritis. I found that very interesting. It is, not surprisingly, characterized by joint pain, swelling, stiffness, and decreased flexibility of joints. It usually affects the small joints first, as well as the same joints on both sides of the body. So both wrists or both knees or, whatever it might be. So again, I found that interesting because other arthritises don't manifest that way. It is diagnosed by a doctor, as you might expect, usually a rheumatologist, who is someone who specializes in arthritis, and it is done via physical exams, blood test, and imaging. So there is not a cure for arthritis. However, it can be managed through a combination of medicine and non-pharmacological treatments. So there are specific prescriptions, disease-modifying anti-rheumatic drugs. Again, that's sort of the first course that people use. However, there are also lifestyle measures like balanced nutrition, quality sleep. There are physical tactics like some daily movement, obviously more gentle movement, maybe like Tai Chi or Qigong or things of that nature. Different kinds of hot and cold treatments, depending, again, on what the pain is. Physical and occupational therapy can also be helpful sometimes. Stress reduction, as well as complementary therapies, so like massage, meditation, acupuncture. Having a good support system in place, of course, is always good if you have any kind of medical diagnosis. There can be some topical remedies that are helpful, as well as some supplements. So again, this is just very basic information about rheumatoid arthritis, not intended for you to use to diagnose or anything of that nature. You can find out more by looking at the Arthritis Foundation or the American College of Rheumatology or in the Merck Manual. Those are several I would suggest, since we all know not everything on the internet is true. So trying to give you places where they know what they're talking about. And if you found this information helpful, and if you know someone who might benefit from it, I would ask that you please highlight this video for them to see. And I really appreciate it. Thanks for joining me for this little tidbit of information today. You can find out more. Actually, I have a longer article about this on the website. So that would be janicerussell.com, and go to the blog and you will find it there. So with a little bit more information, if you want more information but don't want to do some of the research that I did. So again, Janice Russell, so happy you joined me today. Thank you.